Hello guys, today's questions is discuss of pathogenesis, classification, clinical feature, complications of hypertensive retinopathy. Okay, hypertensive retinopathy we have divided into introduction, predisposing factor, pathogenesis, phases of retinopathy, classification, fundus picture, complications and management. Okay, now starting with introduction of hypertensive retinopathy. Hypertensive retinopathy is retinal changes occurring due to hypertension. Okay, here the person will be having hypertension. That's why there will be some changes in the retina. Same as like the person is having diabetes or he will having some retinal changes. Okay, it is because of hypertension. Predisposing factors are severity of hypertension and duration of hypertension and age of the patient. If young patient, narrowing of retinal arterioles due to the spasm. If aged patient, depending upon the pre-existing involutional sclerosis. Okay. If he is young, there will be vasospasm. If he is aged, there will be sclerosis. Pathogenesis of hypertensive retinopathy are results of three changes. One is vasoconstriction, which is another is atherosclerotic changes and increased vascular permeability. Remember three changes: vasoconstriction, atherosclerotic changes, increased vascular permeability. We already know vasoconstriction most commonly in young people, atherosclerosis in old age people, and increased vascular permeability is a common thing. Okay, three changes of hypertensive retinopathy: vasoconstriction, atherosclerotic changes, increased vascular permeability. First, coming with vasoconstriction, there will be primary. It will be the primary response of retinal arterioles that is narrowing. Okay, in pure form seen in young people and in aged people. Narrowing modified by rigidity of arterioles from involutional sclerosis. Okay, atherosclerotic changes manifest as changes in arteriolar reflex and arteriovenous crossing changes, thickening of the vessel wall due to involutional sclerosis. Okay, atherosclerosis changes. Next is increased vascular permeability. Increased vascular permeability is increased vascular permeability, disruption of inner blood retinal barrier due to retinal hypoxia. That is narrowing of a retinal arteriole and retinal ischemia. Okay, as there is vasospasm, there is leak of plasma from the blood to the exterior. Okay, narrowing retinal arteriole and retinal ischemia. Okay, increased vascular permeability is causes hemorrhage, soft exudate, hard exudates, and retinal edema. Okay, hemorrhage, soft exudate, hard exudate, and retinal edema. This is because of increased vascular permeability. Okay. Now, what are the phases of retinopathy? Okay, phases of retinopathy: vasoconstrictive phase, sclerotic phase, exudative phase, complication of sclerotic phase. Okay, first there will be vasoconstriction, next there will be sclerosis, next will be exudation, next will be complication of sclerotic phase. Okay, complications will be there. First, phase 1 and 2 are asymptomatic. Phase 3 and 4 are vision is affected. Okay, phase 1 and 2 asymptomatic, that is vasoconstriction and sclerosis, there will be no symptom. Next, in exudative and complications, we will obviously see vision, there will be defect in vision. Okay, first will be vasoconstriction phase. Okay, focal and diffuse constriction of arterioles. Vasoconstriction means there will be vasoconstriction of arteries. Okay, occurs in second and third order arteries, common in young patient. Next is sclerotic phase, set in where BP remains elevated for prolonged period. Because of hypertension, there will be more sclerosis. Okay, BP will be elevated. Narrowing of the arteries, arteriovenous crossing changes, sclerosis of the vessel walls. Okay, there will be copper wiring and silver wiring of the sclerosis is in. Okay, copper wiring and silver wiring are types. Okay, they are comparing them. Next is vascular tortuosity, increased angle of branching of arterioles. Okay. Next, exudative phase, flame-shaped hemorrhages are seen, cotton wool spots are seen, hard exudates. Next is macular star sign and circinate retinopathy. Okay, in exudative phase, we will see flame-shaped hemorrhages, cotton wool spots, hard exudates, and macular star sign and circinate retinopathy. In complications of sclerotic phase, we will see central or branched vein occlusion, macular edema, and neovascularization. Okay. Once again, in vasoconstrictive phase, there will be focal and diffuse constriction of arteries, occurs in most commonly second and third order arteries, common in young patient. In sclerotic phase, there will be sclerosis and there will be arteriovenous crossing changes and narrowing of the arteries, sclerosis of the vessel, copper wiring and silver wiring. Okay, and increased angle of branching of the arterioles. Next is exudative phase, flame-shaped hemorrhages, cotton wool spots, hard exudates, that is macular star and circinate retinopathy. In complications, we will see central or branch vein occlusion, macular edema, neovascularization. Now coming to classification of hypertensive retinopathy, depends upon the interrelationship of atherosclerotic and hypertensive changes. We have two classifications, that is Keith-Wagner's Barker classification and SCHIEI's classification. Okay, वो आप pronounce कर लो. Keith-Wagner's Barker's classification helps in assessing damage of the heart, brain and kidney. Okay, KWB classification लिख दो उसको. Helps in heart, brain, kidney damages. Okay. Grades of hypertensive retinopathy. Grade 1, that is mild, moderate, high or sustained, malignant. Okay. 1, 2, 3, 4. In grade 1, mild or moderate narrowing and sclerosis of arteries. Cardiorenal function will be normal. Okay. In grade 2, moderate or to marked atherosclerosis and exaggerated of right reflex, that is Salus sign. Okay. Next, it will be satisfactory. Grade 3, high or sustained, marked retinal arteriolar narrowing and focal constriction of cotton wool exudate, superficial hemorrhage, gun sign and bonnet sign are seen. Okay. The evidence of cardiorenal disease. Grade 4, malignant. Grade 3 plus macular star sign, disc edema, marked cardiorenal damage. Okay. It is same like this classification only upside. First will be vasoconstrictive phase, next is sclerotic phase, next will be exudative phase, next will be complication stage. Okay, 1, 2, 3, 4. According to that, they have divided into mild, moderate, high or sustained, malignant. Okay, first will be, you can see here there will be narrowing or sclerosis. It will start. Then there will be atherosclerosis. We will see Salus sign. Next there will be arteriolar narrowing along with cotton wool spots, gun sign, bonnet sign. Okay. Next in grade 3, along with grade 3, we will see macular star and disc edema. Okay. Next, CX classification mainly based upon the arteriosclerosis. Grade 1, generalized arterial attenuation, broadening of the arterial light reflex and concealment of vein and at AV crossing. Okay. In grade 2, severe or generalized and focal arterial constriction, right angle deflection of veins, that is Salus sign. Okay. Here you can see hypertensive retinopathy. They are divided into grade 1, 2, 3 and 4. Okay. Normal one. In grade 1, okay, there will be arteriolar narrowing. Okay, because of vasoconstriction, and you can see Salus sign. And in grade 2, next will be grade 3, bonnet sign and gun sign are seen in grade 3. Next there will be silver wiring in the grade 4. Okay, grade 4. In grade 3, copper wiring of the arterioles, gun sign, that is venous tapering on either side of the crossing. Okay, let me show you. Imagine this is artery. Okay, venous tapering means veins will become thin on the both the side. Okay, and in bonnet sign, banking of the veins distal to the arteriovenous crossing. Okay, banking means like this. They will become thick and banked at the one end. Okay, banking. This is bonnet sign. Next is gun sign. Let me tell you gun sign here only, like this. This is the artery. Gun sign means it will become like this. Okay, this is a vein and this is a gun sign. Okay, and in Salus sign there will be crossing difficulty, like this, like this. This will be S shape Salus sign, S shape Salus sign. Okay, I think all 4 you will remember. Gun sign, venous tapering of the either side of the crossing. Bonnet sign, banking of the veins distal to the arteriovenous crossing. Okay, flame shape hemorrhages, cotton wool spots and hard exudates in grade 3. In grade 4, all changes in grade 3 with silver wiring of the arterioles and disc edema. Once again we will read all 4. In grade 1, there will be generalized arteriolar attenuation and broadening of arteriolar light reflex and concealment of AV crossing. And in grade 2, we will see severe generalized and focal arteriolar constriction and right angle deflection of veins, that is Salus sign. Okay, this vein will come this type, S shape. Diagram you remember, grade 1, 2, 3, 4. Okay, in grade 3 we will see copper wiring of the arterioles, gun sign, that is venous tapering on either side of the crossing, bonnet sign. Next is flame shape hemorrhages, cotton wool spots, hard exudates. In grade 4 we will see all the grade 3 along with silver wiring of arterioles and disc edema. Okay. Now coming to the fundus picture, retinal changes, there will be arterial narrowing, vascular leakage, arteriosclerosis, main 3 things only. Next will be choroidal changes are Elsing spots, Segrist streaks and exudative retinal detachment. Okay. In retinal changes, there will be in arterial narrowing. Because of arterial narrowing, there will be focal or generalized obstruction of precapillary arterioles, and next will be cotton wool spots. In vascular, because of vascular leakage, there will be flame shape hemorrhages, retinal edema, macular star and disc edema. Okay, macular star means at macula will be circular. No, it is like macular stars type of scene. Okay, macular star and disc edema. See, so beautiful macular star is there. Okay, and disc edema. Okay, disc will be edematous. And arteriosclerosis, there will be thickening of the vessel and changes at AV crossing. Okay. In grade 1, generalized arterial attenuation. In grade 2, broadening of the arterial light reflex and deflection of vein at AV crossing, that is Salu sign. Okay. Signs. Now coming to the signs, what are the signs? First is Salu sign, deflection of the course of the vein, vein at arteriovenous crossing. Okay, you can see S shape. I said no, S shape. This is the artery and this is the vein. This is S shape deviation or 90-degree deviation. This is Salu sign. Okay. Grade 3, copper wiring, banking of the veins distal to the arteriovenous crossing, that is Bonnet sign. Next, tapering of the veins on either side of the crossing is known as Gun sign. Okay. In grade 4, we will see grade 3 plus along with silver wiring of arterioles. Okay. In grade 4, we can see Bonnet sign, Gun sign along with silver wiring of the arterioles. You can see silver wiring, this. Silver wiring of the arterioles. Okay. Choroidal changes. Choroidal changes are rare, may occur due to the acute hypertensive crisis in young adults. Elching spots. Elching spots are focal choroidal infarcts. Okay. Small black spots surrounded by yellow halos. Okay. Next, Sergist streaks, that is due to fibrinoid necrosis seen in malignant hypertension and seen as flex arranged linearly along choroidal vessels. Okay. Next will be exudative retinal detachment seen in toxemia of pregnancy. In choroidal changes, we will see three things. That is Elching spots, that is focal choroidal infarcts. Okay, some small black spots surrounded by yellowish halos. Next is Sagest streaks. Okay, because of fibrinoid necrosis in malignant hypertension. Next will be exudative retinal detachment. Okay, now what are the complications of hypertensive retinopathy? There will be retinal vein occlusion, retinal artery occlusion, retinal artery microaneurysm, AION, that is retinal, that is anterior ischemic optic neuropathy, ocular motor nerve palsy, aggravation of diabetic retinopathy. Okay. Complication of hypertensive retinopathy. Next, management of hypertensive retinopathy. Medical control of hypertension essential for good visual function and long-term survival of the patient. BP to be lowered gradually. General measures like weight control, sodium, salt restriction, and exercise. Okay. This is the end of hypertensive retinopathy.